$950 million spent so far on Central Block. The new $1 billion state-of-the-art Central Block at the Port of Spain General Hospital was intended to provide more functional, safe, and efficient healthcare delivery to the population. Yet, almost 3 months after then, Prime Minister Dr. Keith Rowley unveiled a commemorative plaque marking its practical completion. The $1.3 billion facility remains unopened as outfitting continues. And this practical completion ceremony suggested the hospital was ready. A video circulating in March showed unfinished interiors and exposed walls, contradicting the previous government's fanfare and raising public concern over the facility's readiness. The Central Block, managed by the Northwest Regional Health Authority, was supposed to open in July 2025. According to the Urban Development Corporation of TNT, which executed the project, the 540-bed hospital is expected to deliver services in oncology, chemotherapy, pediatric and adult intensive care, coronary care, urology, outpatient services, pharmaceuticals, surgery, ophthalmology, and high-dependency care. Last week, Health Minister Dr. Lakram Bodo said that he would conduct an on-site assessment in the coming weeks, similar to other visits since assuming office, in conjunction with UD-CUT officials. The ministry will keep the public informed and will provide timely updates as we progress towards the commissioning of this important healthcare facility, Bodo assured. Minister of Works and Infrastructure Jarlian John, UD-CUT's line minister, also could not confirm if the hospital would welcome patients within 4 weeks. It has to be outfitted first. I have not seen it myself yet, but it is what we call a base building. A base building refers to a shell. John said she recently met UD-CUT's management team and was awaiting the installation of its board, expected soon. Once the board is there, I suppose we will get a better sense of all their projects. We will make an assessment of where everything is. Cabinet would then be provided with an update, she said. Approved by Cabinet in 2017, the project was first awarded in 2019 to Shanghai Construction Group, SCG, for $1.1 billion. By late 2021, SCG terminated the contract, citing pandemic-related cost surges. This collapse cost the state an extra $110 million and delayed the project by 2 years. UD-CUT retendered the project, awarding 13 contracts totaling $1.1 billion to 5 companies. All of these contracts are included in the overall cost of $1.3 billion, UD-CUT stated. The contracts were awarded to China Railway Construction, Caribbean Ltd, CRCCL, AA Laquis, Trinidad Ltd, ICU Ophthalmic and Medical Supplies Ltd, Western Scientific Company Ltd, and Universal Structures Ltd. Of these, CRCCL received 4 contracts totaling $837.7 million, over 75% of the total. The largest was a $615.3 million for modified design build services. The other 3 were for the supply and installation of information and communications technology, ICT equipment, $79.7 million, refurbishment of the medical library, $13.2 million, and medical equipment, $129.3 million. Universal Structures Ltd was awarded $106.4 million for structural steel and concrete works, later reduced to $92.4 million after savings of $13.9 million. Western Scientific received 3 contracts totaling $99.5 million to supply, installation, commissioning, and training of medical equipment for inpatient major, $53.6 million, laboratory, $41.6 million, and pharmacy, $4.2 million. AA Laquis secured 4 contracts totaling $63.6 million, with the largest $35 million for general surgery. Other awards were $13.2 million for endoscopy, $13 million for head wall accessories and miscellaneous items, and $2.2 million for orthopedics. ICU Ophthalmic and Medical Supplies obtained the smallest contract, $6.6 million for eye surgery equipment. In total, close to $300 million was spent on medical equipment. Items already procured included MRI, Connecticut scan, X-ray, ultrasound, and mammography machines. UD Cut's list also included cath labs, 10 operating theaters, interventional radiology, laboratory equipment, ICU beds, ventilators, pendants, monitors, syringe pumps, and defibrillators. As of March 28, 2025, actual expenditure stood at $949.4 million. The cost of staff training is included in the contracts, UD Cut confirmed. Tiluxing calls for accountability. Consultant in internal medicine, endocrinology, and diabetes, Dr. Joel Tiluxing, said while major investments in healthcare infrastructure are essential, the public has every right to ask, where is the value given the sums spent? Tiluxing noted that systems already exist. What we need is the courage and strength to maintain these facilities. Citizens deserve to see exactly what over $1 billion has produced or failed to produce. Tiluxing, based at San Fernando General Hospital, was placed on administrative leave by the Southwest Regional Health Authority, SWRHA, after a satirical article titled "The Emperor's New Hospital Looking at the Central Block Construction" was published in the Guardian newspaper on March 21st. Then Health Minister Terence Dale Singh later ordered his reinstatement. Tiluxing was recently cleared of wrongdoing after a SWRHA investigation. It clearly struck a chord, not only with the public, but also with those in positions of power. We need accountability for public funds, transparency in procurement, and a full media tour of the site, he said on Friday. Healthcare must not be treated as a political football. He stressed that Central Block was meant to restore dignity to patients and improve conditions for healthcare workers. We do not want repeated delays, escalating costs, and far too many unanswered questions. No gleaming facade can conceal the reality of a system stretched to its breaking point. Tiluxing also questioned the $13 million plus cost of refurbishing the medical library. It's time for full disclosure, independent scrutiny, and above all, a credible timeline for completion that the public can trust. Operation and maintenance will be major state costs. Khan. Former Health Minister Dr. Fuad Khan said he believed a new hospital was not necessary. I think if they had kept the previous Central Block, retrofitted it, and used the money to start the process of putting diagnostic centers in the Port of Spain hospital together with surgical facilities, a nursing hostel, a tertiary medical center for lectures, and a nursing school, it would have been better. He said that approach would have cost taxpayers less. You would have gotten much more value for the same amount of money. Khan added that operating and maintaining the new hospital will generate major costs for the state. Staff, equipment, maintenance, disposables, and continuous expenditure is going to cost the state a lot of money. It's going to be a nightmare to get it commissioned. He said public expectations must also shift. You cannot just give free medical care to everybody and then pay it from the public purse indefinitely. You have to put on the thinking cap and mix it with a public and private sector. So the private sector would pay for the public sector. In 2013, Khan announced that the British government would assist in constructing a medical campus at the hospital via an Inter-American Development Bank loan of $5 billion. The loan would have been repaid after completion at 1% interest over 15 years. That plan never materialized. Even if it opens, it will be at limited capacity, ID Stewart. Meanwhile, president of the TNT Registered Nurses Association, IDI Stewart, welcomed the new 13-floor hospital. As the old Central Block was condemned by the Pan American Health Organization and engineers years ago after the hospital was hit by a 6.9 earthquake in 2018. Stewart expressed similar sentiments to Khan, stating that the health sector has to start generating an income to supplement its expenditure. He admitted that our healthcare services are a burden on taxpayers, stating that this situation would only get worse if we fail to educate citizens about non-communicable diseases. Stewart said health ministers over the years love to see aesthetics and tall buildings dot our landscape. And if they believe there is a building and they see something tangible, they see something visible. They believe that the minister is working. So these UD-cut projects are where our focus has been. He said the World Health Organization has rebuked this, emphasizing that our focus should be on keeping citizens healthy and that our primary healthcare facilities operate efficiently and effectively. Stewart admitted that the practical completion ceremony at the 11th hour of the general election by the previous administration was a game of politics. He said many of these hospitals are still being paid for by taxpayers. And now you have saddled the country with these enormous loans. Following the general election, Stewart said the beehive of activity on the project has slowed down. At this stage, he said containers should be on the site to offload beds, furniture, and equipment. You are not seeing containers resting down in their numbers. Even if it opens, it will open at a limited capacity.